Now, San, what can integrative nursing bring to the patient-provider relationship?
Yeah, so healthcare has been so much. I'm trying to figure out how to condense and give you a short a short answer for this one. So much. I mean, the very foundation um, of a relationship between a healer um, and a patient is that of trust, of empathy, and um, of helping that individual, with their physical, mental, spiritual health. So that's the core of where health comes from. If I don't feel comfortable and confident in my in my provider or in the relationship I have with my healthcare team, or I don't feel heard. I don't feel like I can trust their recommendations, or that they're not addressing all aspects of my health. Then that healthcare is in need of more support, and I think that's why integrative nursing is so critical to it. Because we need to look at that individual as a whole, and it doesn't take a lot of time. It just takes that mindset of when you walk into a room, this is not patient number 3245 cancer patient, but this is Mary, who is 60 years old, and she has a family, and she has breast cancer, and she has two dogs and a cat, and grandkids, and she wants to be able to play with her grandkids, and she's struggling with cancer, but she's also trying to figure out how to manage her diabetes and her weight with it, and she's scared, and she's anxious, and she's worried financially, and she's worried about bothering her family about rights. Like, those are all part of what is Mary's world. And I think just having, being able to look at that individual as a whole, um, it changes the way we can offer care to that person. And it's a reframing of our mind, and I think all of us can do that, and that will make it better in terms of the relationship, and then seeing how we can provide um, the provide actionable hope to that individual in that moment, and in the time that they need to take care of themselves, from from multiple factors, because we are spending very little time with that individual. So what I'm trying to say is, in that moment, being present with the individual fully, seeing them for who they are, and being able to provide them guidance and support that addresses all these aspects of their life that interconnect, um, would be critical, to how, what we can bring to the provider patient relationship with this whole health approach. And I think the other aspect of it is, if we are able to help this individual with the continuity of care, they see me today, but they may not see me for another month. If I can guide them, or give them some kind of support in what they can do every day to empower their own health, then that will be something that's very positive for them, and that's what integrative nursing can bring. Because while they may not have full control about, in this case, Mary, for her cancer, she can come and get her treatments, but whether she recovers from cancer or how much she recovers, that may not be something in her hand that she can do every day. But she could do meditations to calm her mind. She could go for a walk. She could eat healthy. She could spend time with her family. And those would be things that would be nurturing for her body, and for her mind, and for her soul, and for the family that's there with them. And I think those are the kind of things that integrative nursing brings to that patient provider relationship, because it's a bigger spectrum. Um, it's a um, um, it's a more comprehensive, broader view of that individual.